Good morning, ma'am. Good morning, classmates. I am Grethel Joy Ralutin, together with my group mates Vincent Velasco, Deserie Joyce Balico, Ma.Christeta Curameng, and Shiela Mae Villareal. For today's presentation, we will be discussing social media in the connected age, impact on healthcare education and practice. So before anything else, here comes the objectives. The first one is describe the evolution of the internet and the movement toward the connected age. Second, describe the use of social and mobile tools in healthcare education and practice. And the third, identify the challenges and issues related to the use of social media in healthcare education and practice. So we have here the keywords. First, connected age. Second, digital tools. Third, social networking. Fourth, social media. And for the last, mobile apps. So that's all. Thank you. The next slide will be discussed by Shiela Mae Villareal.
Internet provided the necessary infrastructure to revolutionize the way scientists and researchers from the worlds of academia, business, and government could share data, interact, and collaborate with each other. But it was not until the introduction of the World Wide Web that everyday people without computer programming skills were enabled to reap the benefits of this revolution. The web not only changed how governments and businesses operate, it has impacted every facet of society: how we work, learn, play, and now even how we manage our health. Noted by Sarason Khan that the use of social media on the internet are empowering, engaging, and educating consumers and providers in healthcare. In the connected age, everything and everyone is interconnected that ultimately will have an impact on how we learn as well as how we receive healthcare.
So ang first topic ay ang historical perspective. Dito madidiscuss natin ang history ng internet at ang history ng World Wide Web. At malalaman natin mamaya kung ano ang kinalaman ng internet at World Wide Web sa social media at connected age, pati na rin ang kinalaman nito sa impact sa healthcare education at practice. So the internet. The internet is a global information network that connects millions of computers. It is growing exponentially and provides a unique informative resource that is global, diverse, and current. So internet in the 1950s. According dito, the internet has no single inventor, instead it has evolved over time. Pero kapag sinearch mo sa internet, according sa Britannica, makikredit yung ang computer scientist na sina Vincent Cerf and Bob Kahn sa pag-invent sa internet communication protocols na ginagamit natin today, which is referred as the internet. The internet got its start in the United States more than 50 years ago as a government weapon in the Cold War. Scientists and researchers used it to communicate and share data with one another through what was known as DARPnet, or Defense Advanced Research Projects Agency Network. Internet in the 1960s. In 1962, a scientist from MIT and DARPA named J.C.R. Licklider proposed a galactic network of computers that could talk to one another. Such as networks would enable government leaders to communicate even if the Soviets destroyed the telephone system. So my report is about the connected age. But before I give my explanation, let me first read to you the contents of the slide. So Oblinger 2013 introduced the concept of the connected age in higher education. Abel, Brown, and Seuss 2013 described the connected age as an environment that offers new ways to connect things that were previously considered disparate and unconnectable. People, resources, experiences, diverse content, and communities, as well as experts and novices, formal and informal modes, mentors, and advisors. Oblinger 2013 further noted, connecting is about reaching out and bringing in about building synergies to create a whole that is greater than the sum of its parts. Connecting is a powerful metaphor. Everyone and everything, people, resources, data, ideas are interconnected, linked, and tagged. Tweeted and texted, followed and friended. Anyone can participate. As noted by Skiba 2014, in higher education, we can think of this as learning pathways created by the individual or guided by other students or faculty. The bottom line is that learning pathways are about connecting the dots in the classroom, online, or even with people and places outside the traditional academic environment. So bago ma-discuss ang connected age, diniscuss muna namin ang history ng internet at World Wide Web. Bakit? Kasi importante ang internet at World Wide Web sa pag-start ng connected age. Kasi ang World Wide Web, ito yung nagiging platform para magkaroon ng connections ang iba't ibang bagay. According sa binasa ko, the first connected age ay nagsimula noong 1984 kasama ng birth ng World Wide Web. At dahil sa first connected age, nagkaroon tayo ng connection, ng ability to connect to information and the possibility to connect to transact. Pero ang connected age, hindi lang siya about sa dissemination of information. About rin siya sa pagkakaroon or pag-create ng connection with people, resources, ideas, knowledge, at iba't ibang bagay. At sa connected age, hindi lang information ang namamagnify ang reach at ang value, kundi pati na rin yung mga relationships na nabubuo, yung mga opportunities for learning na kikreate, at yung working and collaborating in an unprecedented scale. Kaya sa connected age, anyone can participate. Anyone na may access sa web ay kasama siya sa or part siya sa network of connections. Kaya sa connected age, everything and everyone are interconnected. So ano nga bang kinalaman ng connected age sa healthcare? Ano nga bang kinalaman niya sa healthcare delivery system? Dahil nasa connected age tayo, nagkakaroon ng potential para ma-transform ang healthcare delivery system, para ma-improve pa ang pagbibigay natin ng healthcare sa ating mga pasyente. So in healthcare, Caulfield and Donnelly 2013 offered a model of connected health that encompasses terms such as wireless, digital, electronic, mobile, and telehealth, and refers to a conceptual model for health management where devices and services or interventions are designed around the patient's need and health-related data is shared in such a way that patient can receive care in the most proactive and efficient manner possible. So, ang connected health, isa siyang socio-technical model para sa healthcare management at delivery. At ito ay sa pamamagitan ng paggamit ng technology para makapagbigay ang healthcare service remotely. Ang mga example nito ay tulad ng remote patient monitor, decentralized clinical trials, mobile personal emergency response systems, at yung pinakakilala natin which is yung telehealth or telemedicine. So in this model, patients, caretakers, and providers are connected by means of timely sharing and presentation of accurate and pertinent information regarding patient status through smarter use of data, devices, communication, platforms, and people. So sa connected health, meron ditong real-time electronic communication ang patient at ang provider. Kaya hindi na kailangan pumunta ng patient sa healthcare facility para makipag-usap sa healthcare provider. Kaya nai-improve ang potential ng healthcare delivery system natin in connected age kasi nagkakaroon ng connections without having to have an effort to go to the healthcare facility. So that's it for my presentation.
Social media is used as a broad category that encompasses all of the Web 2 tools. According to Anthony Bradley, social media is a set of technologies and channels targeted at forming and enabling a potentially massive community of participants to productively collaborate, enable collaboration on a much grander scale, and support tapping the power of the collective in ways previously unachievable. According to him, there are 6 characteristics that distinguish social media from other collaboration and communication IT tools. First is participation. Participation echoes the wisdom of the crowds. If the crowd does not participate, then there is no wisdom. Next is collective. Collective refers to the idea of the people collect or congregate around content to contribute, rather than the way of individuals create and distribute content in Web 1 world. Next is transparency. Transparency refers to the fact that everyone can see who is contributing and what contributions are made. Next is independence. Independence refers to any time, any place concept. People can participate regardless of geography of time. Next is persistence. Persistence refers to the notion that information or content being exchanged is captured and not lost as in a synchronous chat room. Last is emergence. The emergence principle embodies the recognition that you can predict, model, design, and control all human collaborative interactions and optimize them as you would a fixed business process.
Next is social networking. Social networking, a major social media platform, embraces many of the defining characteristics of the connected age and is a major component of connected care. First, participation and collaboration were two of the principal themes in Web 2.0 of Eisenbach 2008 and are driving forces behind the social media movement with continued relevance in the connected age. Eisenbach of 2008 further noted, social networking involves the explicit modeling of connections between people, forming a complex network of relations which in turn enables and facilitates collaboration and collaborative filtering processes. Another aspect of social networking is the ability to share user-generated content in the form of videos, stories, or photographs. In addition to adding and viewing content, consumers can also post comments to media someone else has contributed, thus adding another level of communication to these sites of Iskiba 2007. Of the available digital tools, social networking offers the most opportunity for peer support and consumer engagements. Essentially, the social networking site serves as a powerful tool to engage and motivate consumers to share personal information, establish relationships, and communicate with others, with the driving force of consumerism and its use of digital tools, especially smartphones. It is important to examine how healthcare systems can use social media to engage patients in their health and become partners in their care. So, social networking and education. The use of social networking tools, they have embraced the use of social media to engage and retain online learners but also attract potential students to the program. The use of social media in education helps students, teachers, and parents to get more useful information, to connect with learning groups and other educational systems that make education convenient. So, social network tools afford students and institutions with multiple opportunities to improve learning. Through these networks, you can incorporate social media plugins that enable sharing and interaction. Students can benefit from online tutorials through YouTube, online courses delivered by universities abroad through Skype, and a wide array of resources that are shared through social networks. There is valuable knowledge to be gained through social media, such as analytics and insights on various topics or issues for study purposes. The great thing about using social media in education is that you soon learn who the experts are in different fields and subjects. Next is social networking in healthcare and consumers. Healthcare institutions and consumers have already begun to capitalize on the limitless utility of social networking. Numerous hospitals and healthcare-related organizations have social networking sites where patients and visitors can explore details about facility, learn more about available services, and find information about diseases and/or treatments. Of the available social networking sites, Facebook was considered one of the more popular sites and allowed for resource sharing, communication, and collaboration of Mazman and Oswell 2010. And that's all. Thank you.
So let's move on the next topic about mobile health. So when we say mobile health, it is a new tools are introduced in healthcare. It is not only changing the delivery of care, but it's changing the dynamics of the healthcare and the interactions between consumers and their providers. And this is particularly true as one explores the growing of mobile devices and apps that allow for connected health interactions. And according to the World Health Organization about mobile health, it says that we can think of it as medical and public health practice supported by mobile devices. In other words, mobile health technology is the use of smartphones, tablets, and other mobile devices to deliver healthcare and preventive health services. Ano nga bang ibig sabihin nito, di ba? By using mobile devices in the healthcare setting, practices have the potential to enhance productivity, lower failure to respond rates, increase information access, or mas mapapabilis yung pag-access natin ng information natin sa patient through the use of mobile health, and also it improves communication. So, halimbawa pa dito is mas mapapabilis yung pag-response natin in case of emergency by using mobile health like isang tawag mo lang sa cellphone mo sa hotline number ng ambulance, agad-agad silang magre-response, or di kaya naman na through mobile health, it gives patients faster access to providers and care. And unlike traditional and efficient telephone access to physicians and healthcare organizations, mobile health technologies enable patients to quickly send secure messages, schedule appointments like isang text lang sa cellphone, makaka-appoint ka na agad kay doc. And it gives to providers 24/7 for telemedicine visits. So bakit nga ba importante ang mobile health technology? Diba? Medical technologies enable the early and accurate diagnosis of health problems, facilitating timely intervention and improving outcomes. Innovative products can replace, repair, and sustain failing body functions, while telemedicines and connected devices allow remote monitoring of patients' conditions. And that's all. Thank you.
So proceeding now to the benefits of social media. So the eHealth Initiative report in 2014 concluded that social media provides a multitude of benefits to patients by enabling health education and enhancing behavior by first breaking down the walls of patient-provider communication, second, improving access to health information, third, providing a new channel for peer-to-peer communications, fourth, develop meaningful relationships, fifth, establishing communities of patients, caregivers, and family members, and for the last benefit is engaging and empowering people. Okay, so those are just some of the benefits of social media. So proceeding now naman sa challenges of social media. Okay, so according to the eHealth Initiative report in 2014, there are several key challenges affecting the widespread adoption of social media in healthcare. So first, there are concerns about privacy and HIPAA compliance. So HIPAA stands for Health Insurance Portability and Accountability Act of 1996. So it is a federal law that required the creation of national standards to protect sensitive patient health information from being disclosed without the patient's consent or knowledge. So another challenges of social media is that there are also concerns about the balance of transparency and anonymity associated with the sharing of personal information online.
Next, the quality, validity, reliability, and authenticity of information are an issue, especially when there is user-generated information. Next, there is also the challenge of the digital divide, especially with different populations such as elderly, minorities, the disabled, those living in rural areas, and those in poor or underserved areas without access to broadband. And the final challenge in this report also mentions the lack of theoretical and evaluation models for social media given the paucity of effectiveness data. So that's all for my part.
So, as the summary of our report today about the social media in the connected age, impact on healthcare education and practice, there is no doubt that digital tools have transformed the world around us. By providing digital tools to students, healthcare professionals, and consumers, we are transforming healthcare education and practice. The addition of mobile devices facilitates the continuous use of social media tools in every aspect of our lives. In the connected age, learners can create their own learning pathways. According to Oblinger 2013, as they seek knowledge and skills in either formal higher educational degree programs or professional development for consumers, patients, and their families. The connected age provides opportunities for them to become more engaged in their healthcare decisions by expanding their connections from just family and friends to a cadre of other patients or consumers who are like them, as well as a community of healthcare professionals who are experts in their particular health or disease conditions.